Hello everyone. Today we'll be discussing about mammalian lactation. Lactation
Describes the secretion of milk from the mammary glands and the period of time that a mother lactates to feed her young. Today, we'll be discussing about the anatomy of the mammary gland, the 4 stages of lactation, the milk secretion and synthesis, milk secretion and removal, and lastly, the factors that affect lactation. The anatomy is divided into 2 parts, the external and internal anatomy. The external part of the mammary gland is covered by skin, and each species has variations in mammary gland locations, numbers, and the openings per teeth. This figure is an example. For the internal anatomy, it consists of supportive structures which is composed of the median suspensory ligament and the lateral suspensory ligament. The medial originates from the linea alba cranially, while the lateral ligament support and enclose the lateral aspects of the udder. The internal anatomy also consists of milk production, collection, and transport systems. These are the specialized sebaceous glands, myoepithelial cells, lactiferous ducts, gland cistern to teat cistern, and streak canal to exit the teeth, Furstenberg's rosette, and the teeth sphincter muscle. This figure shows the parts of the milk system. For the blood networks of the anatomy of the mammary glands, you can refer to this figure below for the simplified route of the production, collection, and the transport of milk. Lymph networks is composed of lymph and the lymph nodes. The figure shown is the route of the production and transport of lymph into the mammary glands. The nerve supply is also a part of the internal anatomy of the mammary glands, which is very important in the milk ejection process. The figure shown here are the nerves of the udder having afferent and efferent components that connect to the spinal cord.
The 4 stages of lactation.
The mammogenesis is the process of mammary growth and development. This starts from birth until puberty and pregnancy. Lactogenesis. It is the initiation of lactation, where alveolar cells differentiate into milk-producing and secreting cells and tissue. The maintenance and enhancement of an established location is termed as galactopoiesis. The figure below is an example of some major hormones affecting mammary gland development or function. The 4th and last stage of lactation is the involution, also known as dry period. Its purpose is to allow adequate mammary tissue regrowth before the next lactation.
Milk secretion and synthesis.
The milk secretion and synthesis include the increase in appetite, GIT size and function, nutrient metabolism, and weight loss. It takes place during mid to late pregnancy and into lactation. The tables shown are the changes in serum concentrations of presumptive homeostatic hormone, tissue sensitivity, and tissue responsiveness in selected tissues. The secretion of the milk components has 5 routes. These are the membrane route, Golgi route, milk fat route, transcytosis, and paracellular note. For the biosynthesis of milk components, the lactose is the primary carbohydrate in milk and is formed in the Golgi apparatus and packaged in the secretory vesicles. For milk proteins like casein and whey, they are packaged in the Golgi secretory vesicles and include immune proteins, lysosomal enzymes, and protein hormones. The milk fat or lipids are composed of triglyceride, which are variable mixtures of free fatty acids, and etc. Milk secretion. Approximately 35 hours after the most recent milk removal, milk secretion essentially stops. So it has physical limitations, which is the buildup of pressure with alveoli, which result in an inverse relationship between IMM pressure and milk secretion rate, and chemical control, which occurs at local level through a protein fraction called feedback inhibitor of lactation, which is secreted by mammary epithelial cell. For milk removal, it is accomplished when milk is released from the alveolar areas of the gland into ducts and gland and teat cisterns. The oxytocin is released from posterior pituitary contraction of myoepithelial cells, essentially squeezes milk from alveolar lumen.
Factors affecting lactation.
Genetics or heritability could be a factor affecting lactation. Heritability or H2 is defined as an amount of variation that can be explained by genetics. Nutritional, physiological, and environmental factors can also affect lactation. Examples of these are the energy of the animal, the CLAS or conjugated linoleic acids, and recombinant bovine somatotropin. In terms of metabolic disturbances, mastitis, ketosis, and hypocalcemia are the factors. Ketosis is the accumulation of ketone bodies in the tissues, while hypocalcemia is a condition in which there are lower than average levels of calcium in the liquid part of the blood, which may limit the metabolic functions of the animal and could lead to death if untreated. The last one is the mastitis, which is defined as the inflammation of the mammary gland. Most cow dairy farms experience a 25 to 40% of incidence of clinical mastitis. Mastitis therapy. Therapy for IMM infections is the principal reason antimicrobial products are used on dairy farms and result in substantial consumption of other products, like anti-inflammatory drugs.
Normal milk has a pH range of 6.5 to 6.8, while mastitic milk has a pH range of 6.9 to 7.2.
Colostrum. First secretion of the mammary gland prior to parturition. Provides important and in some cases, essential components for health and survival of the neonate.
That's all for today, and we thank you for listening.